Antisocial behaviour is commonly defined as a persistent pattern of actions that deviate from normal behaviours that can harm or show blatant disregard for the well-being and rights of others. When we think about antisocial behaviour in the real world, we often think about people like Tommy. Tommy here is 46. He shows persistent antisocial behaviours by engaging in theft, assault, manipulation, and displays disregard for rules. He lacks remorse, struggles with relationships, and frequently escalates conflicts due to his impulsivity and quick temper. But how did Tommy come to behave in this way? To answer this, we need to look at what motivates the development of antisocial behaviour in childhood. This presentation will briefly identify the risk factors associated with antisocial behaviour in childhood, but for further details, please see the book chapter linked in the description below. So what's the importance of childhood anyway? Infancy, toddlerhood through to adolescence are critical periods of development across all domains, and as such, understanding childhood development is crucial to comprehending the developmental trajectory of antisocial behaviour, as these periods lay the foundation for emotional regulation, social skills, and moral understanding. When we think about what influences development, this process must be viewed as multifaceted, involving a complex interplay of biological, psychological, and social domains. Each of these domains with an array of interacting risk, resource, and protective factors. In considering the developmental trajectory of antisocial behaviour in childhood, the process remains equally as complex. When core areas of influence are dominated with risk, a child may experience disruptions or alterations to their social, emotional, and cognitive development, and may experience difficulties with emotion regulation, empathy development, emotional understanding, and difficulties in navigating social contexts. So let's unpack these risks a little bit more. When we talk about family risk factors associated with the development of antisocial behaviour in childhood, we are often talking about coercive parent-child interactions and their association with negative reinforcement of antisocial behaviours, as well as active and unsupportive parent emotion socialization behaviours connected with child difficulties in identifying, understanding, and regulating emotions, as well as adverse childhood experiences and their association with toxic stress and the effects of development. Moving on to social risk factors and their association with the development of antisocial behaviour in childhoods, what we commonly speak about here is arrested socio-moral development, reactive aggression and hostile attribution bias, and the role of positive emotions in antisocial peer groups. Children displaying callous and unemotional traits are at a higher risk for the presentation of antisocial behaviours. Callous and unemotional traits and their association with low emotional sensitivity, impaired affective empathy, and abnormalities in processing of punishment cues are associated not only with the motivation of antisocial behaviours, but of the maintenance of antisocial behaviours across the lifespan. For a more comprehensive understanding of the risk factors associated with the motivation and maintenance of antisocial behaviour in childhood and its persistence in adulthood, please see the book chapter in the descriptions tab below.